Okay, we are here with Dr. Andreas Eenfeldt, and tell us a little bit about yourself. Who are you?
Hi. Okay, I'm a medical doctor from Sweden.
Yep.
I'm working with in general practice in diabetes and heart disease and stuff like that.
Right.
I'm also in diabetes and heart disease and stuff like that.
Right.
I'm also very interested in low carbohydrate diets for those kind of problems, and I blog quite a lot about it in Swedish.
Sure.
That's my main interest.
And so you joined us on the 3rd annual low-carb cruise to the Bahamas. It was such a thrill to have you. I think you emailed me about a month or two before the cruise and said, "Can I still come?" And I was like, "Yeah, you can come. Not just come, but talk." Because I've written quite extensively about this huge explosion that's happening in Sweden right now with what you guys call the LCHF movement, low carb, high fat.
Yeah.
Tell us briefly how you got involved with the high-fat, low-carb. That's definitely not the conventional wisdom of America or Sweden. Tell us why you decided to go with that route.
Well, I graduated in the year 2000, and I'll say I've always been interested in health and healthy eating and healthy living, and how you get live to get good health and live long and feel good. And it just got quite obvious that the conventional approach with the low-fat, high carbohydrate diet wasn't working very well for many people, especially people trying to lose weight and diabetics. And so I read a lot of books about this, and I think perhaps more than anything else, it was articles by Gary Taubes in New York Times and Science magazine that kind of got me into this low-carb approach to this. And in Sweden, it was getting quite popular in 2006, at least on the internet. We had a doctor called Annika Dahlqvist in Sweden. She's also a general practitioner, and she'd been spreading this message for a few years and had been getting quite a lot of media attention. So that kind of got me in touch with a lot of people who were interested in this. So.
Sure. And you mentioned Gary Taubes' writings have influenced you. You actually told me that you started blogging as a result of his influence.
I read his Good Calories, Bad Calories,
right.
And I thought, my God, this is brilliant. And I felt I had to kind of write a book about this in Swedish, because nobody else was doing it. But I ended up starting a blog, and then that kind of sucked all the time away. So, but I'm writing on my book now.
Oh, so you are writing a book?
Be finished maybe this fall.
Oh, good.
So.
And it will be in Swedish, and you're hoping it's kind of a version of Good Calories, Bad Calories that the Swedes would understand.
It's a book in Swedish. Maybe it's going to end up in English one day.
There we go.
We'll see.
You and I will have to work on that.
Maybe I can make a version of it.
There you go.
International audience. But really, it's very much inspired by Good Calories, Bad Calories, but it's more directed to laymen.
Sure.
People who wouldn't really be comfortable reading 600 pages.
Right.
Small, densely packed.
Exactly.
So I'm trying to make it a little bit more easily digestible, I think.
So tell us about your blog. How can people find your blog? And of course it's in Swedish, so they're not going to be able to understand it in America.
Maybe you can put a link up to it. It's called Kostdoktorn.
And what does that mean?
And that means diet doctor.
Ah.
So.
And so you wanted to kind of put yourself out there as a physician. And saying, look, I have the science to back me up. And I loved your presentation, because in your presentation you gave one chart at the end where it was like, these are the things that they say about carbohydrate restriction, and this is what you can say in response to it. To talk about some of those things, because I really thought that was the best part of your speech.
Okay, well, I think science has pretty convincingly shown in the last decade or so that saturated fat is not the villain that we've been thinking. Saturated fat is, if you combine all the science there is on the subject, it seems that it's completely safe to eat saturated fats, and there's no reason to avoid it. Also, when it comes to carbohydrate restriction, when you look at the big scientific studies on it, you find that you get more weight reduction, you get better cholesterol values, you get better blood pressure than using a low-fat diet. So there is no point in low-fat. It's just completely useless and can be dangerous for people with weight problems or blood glucose problems like diabetics.
Mm-hmm.
So I would say that people call low carbohydrate diets safe fad diet, but I believe that low fat diet is the true fad diet.
Yeah.
And it's been around for 30 years, and it's only made people fatter and sicker.
Wow. Now, you flew all the way to America, Jacksonville, Florida, just to join us on this here cruise. I mean, we've just had a meeting for the last few days in this very room, and it has been an unbelievable time. What was it that motivated you to want to come, number one? And number two, what do you think was the best thing you got out of this conference?
It's the Bahamas.
The Bahamas, man!
Why wouldn't I want to come?
Exactly.
But I think the number one thing was just to meet with a lot of interesting people that have been reading what they've been writing, and it's nice to meet you, for real, and Mary Byrne.
Yes, I'm a real person.
William Davis and Tom Norton and
right.
Lots of other people I'm forgetting now. But
yeah.
Really just meeting you in person, that's been the number one thing.
Well, I have been impressed with you from the very start. You are a very kind man, very gentleman. I love your rationale. You don't overreact about anything. It's almost as if you kind of expect, you know what, people are going to have objections to low carb, but it's okay to remain calm, relaxed, and give them the science, because the science, as Dr. Annika Dahlqvist in your country has shown, the science is going to prove her right, you right, Dr. Vernon right, all these people that are talking about these things right. And that's what's so exciting about the whole low-carb movement in 2010.
Yeah, and I really believe that it's a paradigm shift coming up where we won't see fat as the enemy. It's going to be the refined carbohydrates, sugars, and I mean, nobody is arguing against that, but the problem is they still believe that fat is bad, and I think that's on the way out.
Sure,
and
sure.
In 10 years, it's going to be like just recognized as a big mistake, I believe.
So if you had one message you could give to Americans with the Swedish example, what would you say to those people in America who think, you know what, that low-carb diet, it's just not going to work for me, it's too much this, too much that. What would you say to the people that would object to low-carb in America? Why are they wrong?
I would say low-carb is just good, common sense, tasty, old-fashioned human food. It's meat, fish, eggs, vegetables, butter. Tastes good, makes you slimmer and healthier. So
yeah.
What's not to love about it?
Exactly. Well, Dr. Andreas Eenfeldt, it's such a pleasure, and we are thankful to have met you. You are a dear friend, I will consider now, and hope to definitely see you in the future. You and lots of Swedish people come on our low-carb cruises in the future. Thank you so much.
Thank you for having me.